We're going to have to stop apologizing to ourselves for lousy schools, for not having dealt with our entitlement problems, for spending too much money. We got to stop apologizing to the world. We worked together. We got everybody insured. But there were some big differences between what we did and what's going on in Washington. What we did, we said, look, it has to be done on a bipartisan basis, or we'll never change something as big as health care. Number two, it's best done state by state, because getting everybody insured is very different to do in Massachusetts than it is in Texas, where you have so many more that are uninsured. Number three, we said we're not going to raise taxes. We're going to have to do this within our current budget. And finally, we're not going to cut Medicare as the means to do it. All of those things, I think, make the president's plan just unacceptable to the American people.
Yeah, let me ask you, though, you say you're not going to cut Medicare, and Republicans have been critical of some of the proposed cuts in Medicare, but you just said off the top we've got to face our entitlement crisis. There's no greater entitlement crisis than the explosive growth of Medicare. Yeah. Will you admit right now to America that if Medicare is going to exist after 2019, it's going to have to cut Medicare?
Tough choices.
Look, there's no question about that. The way the president's health care plan works, he just says we're going to take $500 billion out of Medicare Advantage. It's like, wait a second, let's talk about a better approach than just slashing a portion of the program.
But isn't that a private program? If you had to go after Medicare costs, wouldn't a private program be the way to go after Medicare costs?
Well, the best way to go after Medicare costs, in my view, is to help reform our entire health care system by changing our incentive system. Right now in health care, the individual consumer has virtually no stake in how much something costs.
Right.
Because the doctor in the hospital decide what they're going to get.
Problem.
That's the problem.
The incentive in our system is an incentive for profit.
Yeah.
And not an incentive for wellness.
Right. So changing that is the right way to change Medicare. And let me just tell you, you're absolutely right. Unless we deal with the entitlement burden we have, which is about a $60 trillion unfunded liability, America's future could be very, very bleak for our grandkids. Not for, it's going to be, we're kicking it down the road, but that's unacceptable.